nurses. Hey, Remar nurses. It's Wednesday. It is Winning Wednesday, and I'm live still from Manila, living in two worlds. I have the Philippines business going on, and then I also have my US business going on. And right now, I'm actually, even in my US business, I'm working with school, and we are developing curriculum. And let me tell you something about acute pancreatitis. I'm going back to it. But as I'm developing a curriculum, let me tell you something about you, and the challenge to pass NCLEX based off where you are. One of the things that you may not know is that when information is put in front of you, you actually decide if it is important or not. Okay. As an instructor, I am learning that I can tell you 10 things about acute pancreatitis, but you will only commit to memory what you think is important. And that is just the reality of working in adult education. And so if you are serious about passing the NCLEX, today we will evaluate whether or not you are deciding, because this is your journey. We will look at if you are deciding to focus in on what's important. Okay? You are an adult. You are not learning in the same conditions as a child, even though some instructors will teach you that way. You are not. You are very independent in your thinking. You know it. You decide based on your experience, what you like and what you don't like, what you will do, what you won't do. So I'm going to do this class a little bit different. We are talking about pancreatitis. It comes from quick facts. And so I give you this book to read. I give you this book to, self-pace through the information, but I'm also challenging you to really dive deep into the things that we're talking about. So thank you so much for coming to class, because I know you're busy. I'm not going to waste your time here. Open up your books and let's turn to page 66 in this book. We're going to just read acute pancreatitis from Quick Facts, and then we'll dive into what you are supposed to be understanding about it. Okay. So let me just do my housekeeping things. Of course, we know next month is Nurses Week in the United States. So we will be celebrating Nurses Week as a community, as a study group. This is very important. We will have some important concepts and videos and just elements of your nursing school, your fees, and then also your NCLEX prep coming up. Also, after that, we will be rolling right into Remar Nurse University, which is our pharmacology review every Monday for the month of June. And so we will be getting more into that, how you can participate. Remar Nurse University, it is the largest community event that I do every year. Okay. So again, hi everyone. Come on in. We're just getting started with class. We will be discussing acute pancreatitis. Now, let me just give you this one slide for acute pancreatitis. We know that we are talking about what organ. We are talking about the pancreas. We know it is an inflammation based off of the terminology pancreatitis. So we see that itis, inflammation. And so what happens is there is a disarray of the functions of the pancreas. Looking at the endocrine role, looking at the digestive role, these things will not be correct. And when you think about, the job of the pancreas, when there's a malfunction in the pancreas, we can anticipate the patient's clinical future. Remember, I told you had to be a fortune teller in this way. And so let's just read page 66. So in pancreatitis, what is the number one cause of pancreatitis? So I have here alcohol abuse, okay? What are the symptoms of acute pancreatitis? And I'm just reading and you're listening to this. I will be going into some questions in just a bit to really break this down. But the first step of understanding quick facts for NCLEX, okay, if you don't have this book, get this book. The first step of understanding this book is just read it. Just read it. So we have the symptoms are abdominal pain, nausea and vomiting, a board-like abdomen, and then skin discoloration. Okay. Will eating make the pain better or worse? Will eating make the pain better or worse? Well, the correct answer here is Winning Wednesday. But also, this is an adult class, right? And I know I'm not the only one with kids. And so you hear Selah crying in the background. I may have to go and get her. But let me just continue on because she is with her dad. And this is a study group. So I want to be dedicated to the study group too at the same time. Okay, so when we talk about pancreatitis, we know that eating will make the pain worse. Remember, the whole thing about pancreatitis that the patient will come in presenting with is not, oh, I'm feeling nauseated and vomiting. That's something that will happen, right? The patient won't say, oh, my stomach is so tight, it feels so hard. They're not going to come in with that as the reason they're there. What is going to be driving them to the emergency room? What is going to be driving them to the emergency room? It is going to be abdominal pain. That abdominal pain is the presenting symptom. So keep that in your mind. Keep that in your mind because it's something that we read and it's something that we say, but we really got to understand what is happening. And so will liver enzymes be elevated with pancreatitis? Which ones? We have the lipase and amylase. And then what are the nursing interventions? Extremely important with acute pancreatitis. Again, as I'm saying them, see if you can make the connection on why this is the right nursing intervention. So we make the patient NPO. Why does that matter? An NG tube may be used to reduce gastric distension. IV fluids to prevent dehydration. The client should be educated on the detrimental effects of alcohol. Okay. All right, and then I have here, how the pain is treated. We're going to give an opioid for this type of pain because it is intense. So after saying all of that, okay, we understand all of that. And by the way, one of the things that I do want you to understand is that as an adult who is studying for this exam, it is very important that you have direction. It's very important that you have direction. And you need to have a system that is going to challenge you, but also keep you accountable because most adult learners struggle with consistency. And that is because you have a life. You have kids crying in the background. You have to go to work in a few hours. And so I am encouraging everybody to get the V2 system for that study partner, to help you stay accountable. Now, let's go into some NCLEX questions. I'm going to do them a little bit differently, but my priority today is to make sure you are using this product correctly. If you have this product, you need to use it correctly. So my first question, just going off of what we read, because we just read straight up, what is the number one cause of acute pancreatitis? Alcohol abuse. What are the symptoms of acute pancreatitis? The first one is abdominal pain. So my question is, this was question number one. What is the reason for the pain? And don't just say that the pancreas is inflamed. Because why is the pancreas inflamed? You just read that the patient's having abdominal pain. Why is that? What's causing the pain? What's the real issue here that we are talking about? What's the real issue with pancreatitis? Does anybody know? Put it in the chats. Put it in the chat, put it in the comments. And I love when we're able to just sit and talk. Like, let's just sit and talk. I'm not doing multiple choices. I'm not doing that today because I need you to be prepared beyond NCLEX. I need you to be prepared when the patient says to you, why am I in such pain? Or why do you have me taking this medication? You got to be able to explain it as a nurse. That's what makes a great nurse. Okay? Kindness, just patience, but also knowledge. All right. Correct answer is enzymes. Enzymes. Remember, the pancreas is what type of organ? The pancreas is a digestive organ. Okay. And so it makes enzymes to help you digest food. Okay? And this is just basic pathophysiology. This is the stuff we learned before. This is these are the prerequisites that we have to take to get into nursing school. So we know that the pancreas is a digestive organ. It's going to make enzymes. Well, what happens is those enzymes begin to irritate the pancreas, but not only irritate the pancreas, because enzymes are used to break down food, right? So the enzymes begin to actually eat away the pancreas. It's a process of autodigestion, right? And we learned that. So that's what's causing the pain. The body is literally eating the pancreas. Oh my goodness. Is that painful? Yes, it is. So that is why our patient is complaining that they have so much pain because those enzymes are not breaking down food. They are breaking down the actual organ that made them. Yeah. Okay. Did you get that? So I have this image here because you may not understand how enzymes are moving through the system, how they're working, how they break down food. So the pancreas has enzymes, the digestive enzymes. Now, they are supposed to be inactive when they're in the pancreas. And they travel not through the bloodstream, they travel through ducts. So enzymes travel through ducts, not blood vessels, not veins, anything like that. So the pancreatic enzymes go through the pancreatic duct into the small intestine, and that is where it is supposed to be activated. Well, with pancreatitis, those enzymes are being activated early, way too early in the actual pancreas. Okay, so that's what's causing the pain. Got it? Now, you should be writing these things down. You should absolutely be writing these things down. This book should never be passed down to anybody else. If you can give this book away, that means that you have not really studied it, because it should be written all over. It should look like a mess. So make sure you're writing these things down. Now, I asked this question: how is the pancreas an endocrine organ? I said the pancreas was a digestive organ, but it's also an endocrine organ. How is that? How is that? Okay, very good. So the pancreas is also making hormones. The pancreas is also making hormones. That's what makes an an endocrine organ. And I don't know, do I have the answer here? Yes, it produces insulin. Okay, so we know that patients are not only going to have problems with abdominal pain, but just by the nature that this is an endocrine organ, we know that they're going to have problems with their blood sugar too, because a damaged pancreas is not going to be able to make the proper amount of insulin. Okay. All right. So we're studying. And this gets me so excited because really, if you understand this one condition, acute pancreatitis, you will be able to look at gastrointestinal issues very well. You will also be able to look at stomach issues like acid reflux differently. And this just positions you for so much more critical thinking when you know this information. Okay, here's a question. If a patient had acute pancreatitis, would they have more pain lying down or sitting up? I said this in this book, so did you catch it? Did you take hold of it? Okay. Correct answer is going to be supine position. So lying down flat is going to be a challenge for these patients. It's going to be difficult for them to do. So that is also one of the things that would, if a patient was coming in with abdominal pain, maybe the doctor might say, oh, is this GERD or is this acute pancreatitis? So you'll be able to know like some similarities between the two and some differences as well. Question number 4. What is the reason for NPO status? What does it prevent the body from doing? Relate this back to pancreatitis. So we know one of the nursing interventions is to make the patient NPO. Why do we do this? What is it for? Is it for just bowel rest? Is it for that? But it is specifically related back to pancreatitis for me. If a patient is NPO, if they are not eating, that means that the body cannot do what? Or it would not do what? It means that the body would not make the digestive enzymes, which are causing this issue. Okay, so that's the connection between the NPO status and pancreatitis. What else do I have here? I don't think I put this one on here. Let me show you. Yes, it stops the body from making pancreatic enzymes. So that is the reason for NPO status with pancreatitis. Now, there's one thing I want you just to be sure, just make sure we're on the same page, is this. I say on page 66 that acute symptoms include skin discoloration. Why does the NCLEX care about Cullen's sign and Turner's sign when it comes to pancreatitis? Why does the NCLEX care about that? What is the reason why? Well, the reason why is because skin discoloration indicates what? It is a sign of hemorrhaging. It is a sign that your patient has internal bleeding, which is a big emergency. It is not just, skin discoloration. It means that your patient has internal bleeding, okay? So that's the importance of Cullen's sign when you see it on NCLEX. All right. Okay. So that's it. That's what I just, I wanted to just come on here really quickly and just show you kind of my process when I'm going through quick facts. Again, I am taking notes. I'm reading, I'm asking myself questions, and that's what you should be doing with this resource. It is not just something that you're reading and then you close it up. Because remember, your challenge is you have to you have to decide that this information should be retained. And you have to make sure that you're engaging with the information. Because if you're just passively studying, if you're watching these videos but you're not commenting, if you're watching these videos but you're not writing things down, you're just passively studying. And that is not going to be the best way for you to make progress. So as I'm working with this school, developing the curriculum, there has to be some activities that demonstrate learning is taking place. Learning is taking place. So when you come here and you actually do the questions and you try to answer the questions, that demonstrates to you that learning is taking place. Okay. All right. So I'm going to just wrap this thing up. Get in your V2. Get in there and get this work done. Get in there and get this work done. We have the ability to get you to where you need to go faster. And it's not just about the speed, but it is about the principle that time is very valuable. It is the most valuable thing that you have. So don't waste it. And remember, you can, you will, and you must pass NCLEX.